What's up everybody? Welcome back to my YouTube channel. Today's topic, miscarriage. This is going to definitely be a difficult video to film, but I think one that's also very necessary. Obviously, when we start talking about difficult subjects or difficult things that can happen to us with our bodies, with our pregnancies, getting a bad diagnosis, with cancer, with any subject that's really heavy, it's hard to sit down and have a conversation. But I also think it's extremely important, which is why I'm filming this video today. In case you're new here, hi, I am Dr. Allie. I am an OBGYN, and here on YouTube, I talk about all things women's health, from pregnancy to periods to anything and everything in between. So I hope you will join this little family of mine. Go ahead and hit that subscribe button so that you don't miss one of my new videos. So today's topic is going to be all about miscarriages. Did you know that early pregnancy loss is actually extremely common? It occurs in about 10% of all clinically recognized pregnancies. So miscarriages is something that's very common, and as an OBGYN, I see it all the time in the office. But I don't think people realize how common it is because a lot of people don't like talking about it. It can be an extremely traumatic experience, and maybe an individual person doesn't want to continue to relive that. So I think it's really important to talk about so that you understand why miscarriages might happen, what the next steps are, what the treatment is, how long do you have to wait to start trying to have a baby. I'm gonna answer all of those questions in today's video. In case this video format isn't for you, over on my blog, which I'll leave linked down below, I made an entire post about miscarriages, going through exactly what I'm gonna explain today. I just understand and realize that some people might prefer the video versus the blog post, so make sure you check it out. Before I jump into the meat of the video, I do wanna explain something. So in medicine, when we start talking about miscarriages, the medical term that we use for this is abortion. Whether it's a missed abortion, a spontaneous abortion, an incomplete abortion, a complete abortion, and then you also have an ectopic pregnancy or an elective abortion. Now, I've seen a lot on social media about not referring to a miscarriage as an abortion. I know the word abortion has a lot of negative stigma around it. It is an extremely political issue, and automatically when we hear the word abortion, we think of an elective abortion or someone wanting to terminate the pregnancy. I want you all to understand that when your physician or your medical care provider or your OBGYN may talk about having a missed abortion or a spontaneous abortion, which is another term for miscarriage, they are not referring to the termination of the pregnancy because that's what you wanted to do or anything like that. The word abortion, in the sense of it clinically, has been around for hundreds of years before we even clinically thought of an elective abortion. The word abortion stems from the Latin word, so it's been around for a long time, and I don't want you to take offense if your medical provider or anything like that happens to mention that word. They don't mean it with ill intent, and it's just something that's interchangeable in medicine. Now, when I see my patients in the office, I try to make that very clear. I try and make sure and just use the word miscarriage because I do realize that there unfortunately is a negative stigma tied around to the word abortion, even though I don't think there needs to be. But just to be sensitive for everyone around, I typically tend to use the word miscarriage. So just to recap, the terms spontaneous abortion, early pregnancy loss, and miscarriage are all interchangeable in the field of medicine, and they all mean the loss of an intrauterine pregnancy in the first trimester. In this video, I'm going to review the most common cause of miscarriage, how we diagnose it, and the management options. All right, so let's jump right in to start talking about miscarriages. As always, I like to start my videos with definitions. So let's define an early pregnancy loss. This is defined as an intrauterine pregnancy with either an empty gestational sac or a gestational sac with an embryo or a fetus that does not have fetal cardiac activity. And this is seen within the first trimester, so up until about 12 weeks and 6 days gestation. So what are the causes or risk factors for a miscarriage? So 50% of miscarriages are caused by something that's called chromosomal abnormalities. Now, before I jump into that, I want to quickly let you know that if you have had a miscarriage, you're currently going through a miscarriage, or just found out that you had a miscarriage, I want you to know that this is not anything you did wrong. It's not anything you could have done to prevent it. It is not your fault. It is not the fault of your partner's. Miscarriages, as I said, about 50% occur because of chromosomal abnormalities. This is something that is out of your control and you couldn't have done anything to prevent it. And I want to make sure that you understand that you should not blame yourself or blame anyone else because of the miscarriage. This is not your fault. So what does chromosomal abnormalities mean? Because I do realize that is kind of a fancy, obscure medical term. Essentially what it means is that your own body recognized that this was not going to be a normally developing pregnancy. Our bodies are extremely smart and able to recognize this. So your body says, hey, this fetus is not developing normally. There's something in the chromosomes. And so your own body lets the pregnancy pass. I want you to think about it this way. In order to make a baby, you have your cells and your partner cells, and those cells have to line up absolutely perfectly to form this fetus or a baby. So say for whatever reason, when your cells and your partner cells are coming together, not everything lines up perfectly. Your body realizes that these haven't lined up perfectly. Your body recognizes this and says, this is not going to be a normally developing pregnancy, so it lets the pregnancy pass. So what are the most common risk factors for a miscarriage? One is going to be a prior history of a miscarriage. Another one's going to be advanced maternal age. Now I covered this in more detail on my previous YouTube video where I talked about advanced maternal age or pregnancies after the age of 35. Women who are over the age of 35 and trying to conceive do have an increased risk of that pregnancy resulting in a miscarriage. If you want more info on that, I'm gonna leave that video linked down below so that you guys can watch it and understand better why that is. I also have a blog post about this, so I'm gonna leave that link down below. So what's the frequency of miscarriage? How often are we seeing it? So frequency of early pregnancy loss in women aged 20 to 30 is about 9 to 17%. When you look at women over the age of 35, this jumps up to 20%. And when you look at women over the age of 40, this jumps up to 40%. So we know that as a woman ages, there is an increased frequency of miscarriage. So what are going to be the symptoms of a miscarriage? The symptoms of a miscarriage are going to be cramping and bleeding. Now this is difficult to understand because cramping and some bleeding and spotting can also be a normal part of first trimester symptoms. It can also be signs of an ectopic pregnancy or a pregnancy that's not inside of the uterus, or it might be signs of a molar pregnancy. If you follow YouTuber Desi Perkins, she has an entire video where she shares her experience with a molar pregnancy. If you don't know what a molar pregnancy is, again, I have a blog post dedicated to that because molar pregnancies, while they're rare, we still do see them. So if you want more info on that, look at all the links. There's a bunch of links down below. Okay, so back to symptoms. How do we differentiate and tell the difference between normal pregnancy or miscarriage? So a lot of this is going to depend on the patient's physical exam and the patient's history. When we start talking about miscarriage, the cramping and the bleeding that is seen with it is a lot more severe cramping and a lot heavier bleeding than just the slight cramps and a little bit of pink or maybe light red spotting that we see with a normal pregnancy. So again, there's a difference in the severity. It doesn't always apply, but we can see that. As an OBGYN, how can I diagnose this? There's two things we can look at: ultrasound or HCG level. HCG is going to be the pregnancy hormone. So out of all of these, the best one to use is going to be ultrasound. Sometimes that means doing one ultrasound and we're able to diagnose it, or maybe you do one ultrasound and then you need to repeat it in a couple days or a week just to see how the pregnancy is progressing. Keep in mind that everyone's presentation is different, and just because one person was diagnosed one way, it doesn't mean that the next one's gonna be diagnosed in the same exact way. Because right, just like I always say, medicine is not one size fits all. So whether it was by ultrasound or maybe blood work, or you had cramping, bleeding, or whatever it may be, you get diagnosed with a miscarriage, what are your management options? What treatment can you get? What do you do next? What should you expect? Let's go over it. When we talk about miscarriage, there are three management options. You have expectant management, medical management, or surgical management. All of these options should be offered to you and explained to you. You should sit down with your doctor and figure out which option is going to be the best one for you. There's going to be situations where some patients will benefit more from a surgical option, whereas others, maybe it's expectant management. So sit down, review your options, and decide with your doctor together. So let's review expectant management. This option is limited to the first trimester. In about 80% of women, the pregnancy will pass without having to do any surgery or any medical management. With expectant management, you may experience moderate to heavy bleeding and cramping as the pregnancy is passing, and you may need a prescription for pain medication from your provider. All right, let's talk about medical management. This option can be considered for patients as long as there's no severe heavy bleeding, there's no infection, and there's no contraindication for the patient taking this medication. So make sure you ask your doctor. This is for women who want to shorten the time from expulsion of the pregnancy, but want to avoid surgical management. Now this brings me to another point. I've seen a lot of TV shows or movies that they talk about miscarriages. More specifically, I just finished watching The Bold Type, where one of the characters on there goes through a miscarriage, and when she gets diagnosed, the doctor tells her that in 48 hours, she's going to pass the pregnancy. This is actually not true. There's no way for me to know when the pregnancy will pass. Whether it's expectant management or whether you get medication to help pass the pregnancy, I can't tell you that in 2 days you're gonna start bleeding, because everybody's body is different. So if you decide to do expectant management, you really just need to keep an eye out on the moderate to heavy bleeding and cramping. Now, if you're choosing to do the medical option, we do know, since you're taking the medication, it will shorten that period of when you expect to pass the pregnancy, but there's no way for me to predict exactly what time and day that will happen. Now, as far as the medications, there's different ways we can do this. There can be just a pill that you take, there can be a pill that's placed vaginally, or there's even sublingual options for medication. For some women, you might just need 1 dose of the medication and then the pregnancy passes within 1 to 2 to 3 days. For other women, you may need multiple doses. Again, everyone is different, but make sure you talk to your doctor so that you can figure out which option is best for you. By doing the medical management option, you should expect heavy bleeding with some pretty intense cramping. So most doctors or most providers will write you a pain medication prescription. Now let's talk about the third option, surgery. The surgery that we do for miscarriages, it's called a D&C, or a dilation and curettage. Now this option is offered to all, but it's definitely an option that may be necessary if the woman presents with severe heavy bleeding that we can't control. Compared to the other two options, having surgical management with a D&C is going to provide a more immediate completion of passing the pregnancy with less follow-up. So for some patients, this might be the ideal situation. You go and have the surgery and then you're done. Everything's taken care of. You don't need to continue to follow your bleeding or your cramping or anything like that. The surgery's done, the pregnancy passes, and that's it. But at the end of the day, this is a surgery and it may not be the best option for other people. So when comparing all three options, which one's best? Again, this is going to vary patient to patient. With all three options, experiencing cramping and bleeding is expected. Now, when we talk about complications with any of them, all of them are extremely rare to see any sort of complications, even including the surgery. Having heavy bleeding with the surgery is expected, but to have further complications, very low risk. Now, a lot of people talk about forming adhesions or scar tissue after having a D&C. Again, this is going to be more rare. Has it happened? Yes, but chances are very low. Hemorrhage or heavy bleeding and infection can occur with all three options, but again, rare. So your preference or the patient's preference on management should really guide us as clinicians as to what to do. Okay, so you had a miscarriage, you either took the medical management, expected management, or you had the surgery. Now, when can you start attempting for another pregnancy? Recommendation after having had a miscarriage is to avoid intercourse for 1 to 2 weeks. So that means nothing inside of the vagina 1 to 2 weeks after passing the pregnancy. Now, as far as how long to wait before trying to conceive again, there's no set rule or no set guideline on what is best, but there are 2 options and 2 recommendations, so let's go over them. One of the options is to wait 3 months after your miscarriage. So once the pregnancy is passed, or you had the surgery, or whatever option you chose, from that date that you passed the pregnancy, wait 3 months before trying to attempt pregnancy again. The other option is to wait for your next normal period. After a miscarriage, it might take a month or maybe a couple weeks before you have your normal, regular menstrual cycle again. So those are gonna be the 2 guidelines that are available right now. Either waiting 3 months, waiting to get your next normal period, and then you can start trying. Again, have this conversation with your doctor and see what option is gonna be better for you. So what type of workup may be necessary after a miscarriage? Typically after a miscarriage, there's no further workup that we need to do because miscarriages are so common. Now, if you've had 2 or 3 consecutive miscarriages, meaning 2 to 3 miscarriages in a row, then that kind of alerts us as, is there something else going on? It's not normal for us to just continuously have miscarriage after miscarriage after miscarriage. So if you're in this situation, you definitely need to make an appointment with your provider and sit down and figure out if there's other blood work you need to do, maybe ultrasounds or something to try and figure out why you're having recurrent miscarriages. All right, so that brings me to the end of this YouTube video. I know this is a really difficult subject and something, like I mentioned before, that is very traumatic and difficult to go through. I want to reiterate and make it very, very clear to you that there's nothing wrong with you and you did nothing wrong, and this is not your fault if you are currently going through a miscarriage. I also want you to know that you're not alone. Like I mentioned in the beginning, miscarriages are extremely common. People just don't like to talk about it openly. But if you are having a very difficult time with this, please reach out to someone, reach out to your doctor, a friend, a family member, or whoever it is, but you should talk about it so that you could properly grieve this loss. Another thing to keep in mind when trying to decide after a miscarriage when's the next best time to try for pregnancy, also make sure that you're in the right place mentally and that you've appropriately grieved this miscarriage that you just had. I hope you found this video helpful, and if that you're currently going through a miscarriage, it kind of made sense on next step, why it happens, all that stuff. As always, I'm gonna leave all of my social media handles linked down below, from TikTok to Instagram to my blog. I've written a lot about miscarriages over on my blog, and like I mentioned, molar pregnancies. So there's a lot of good information over on the blog, and everything is written in both Spanish and English. All right, you guys, I hope you have an amazing day. I hope that you have a good start to this week. If you're not already subscribed to my YouTube channel, I would love it, and it would mean so much to me if you joined my little family here on the internet so that you don't miss any of my other videos. If you have any questions, any requests on any other topics, leave them down below so that I can get them filmed. Always remember to be kind and show love to everyone around you. I love you guys so much. You truly, truly mean the world to me. Bye.